Hi everybody, let me introduce myself first. My name is Dr. Scott Keller. I'm the co-owner of Synergy Chiropractic Spine and Joint Center here in Lincoln, Nebraska. Our practice is down on 56th and Pine Lake right now inside the Madonna Proactive Fitness Facility, Lincoln Medical Park building. I'm just honored and feel really humbled to be able to have the opportunity to present some mobility and stability type things to you guys as far as the Lincoln Firefighting Department. Thank you to Cole Henn and Kelsey Romshek and some of those guys who kind of head up the wellness department and have gotten you guys a lot of this information. Cole and I were talking not too long ago, and we just thought it would be really good to capture some of these concepts in video format and then be able to pass them along to you guys. And I'm also going to probably just use this on our Facebook page, on our website, so as many people as we can get this knowledge to, the better. So hopefully these will help you out. If you guys or ladies ever have any questions at all about any of the concepts I go over, any of the exercises I go over, our phone number is on this banner right here, 402-328-2660. You can also email me, scott@synergylincoln.com, SCOTT@synergylincoln.com. So don't hesitate to do that. I'd love to help all of you in any way and form that I can. So we're going to get started today. There's a reason that I'm barefoot. We're going to start with a concept that is super important for a lot of different reasons. Some of the concepts we're going to go over starting in the foot today, they're fairly complex. There's a lot of dynamics that go into these things, but you know, there's just always somewhere you can start. You know, some of you guys aren't going to know whether you have these problems or not, but we're going to go over some easy ways to maybe identify if you do, and then how they affect the body and what you can possibly start to do on your own to self-correct or at least be proactive in your own body mechanics and your own health and well-being. So, like I said, I hope some of these things help, and if you guys ever have any questions, obviously we can dive more into it if you give me a call or an email. So the concept we're going to cover today is called the tripod of the foot. So just like any tripod, there's 3 points of contact. If you look at my picture right here, which don't judge me on my drawing, but you have the big toe and then the 4 other toes, and you have your heel down here. The tripod of the foot basically means a point in the center of your heel, and then the point at the base of the big toe and the base of the little toe that form this triangle or tripod. The way the foot functions, we're meant to be barefoot. I mean, our feet are designed to be in contact with the ground, to mold and to feel what's going on. That's called proprioceptive input. When we're thrown in shoes as little as, you know, when we're just an infant or toddler, it starts to kind of interfere with some of that proprioceptive input we get. So first of all, maybe in your kids or people that you know that have kids, make sure they're barefoot a lot. That can really help just mechanics of the body as they age. But basically, as I drew up here, the base of the heel, base of the big toe, and base of the little toe. The main principle here is to, when you're standing on 2 feet or in a single leg stance, you should maintain equal pressure between those 3 points when you're going through any kind of a movement, such as a squat, a lunge, some of those types of things. When you're running or walking, obviously we're going to have a little bit of a different effect in how the foot moves and where that pressure is being placed. So we're going to basically talk about, I know a lot of you guys are active, you work out, you do things such as squats and lunges and all these kind of different things. So let's just concentrate on that today. If you feel like or know that you have dropped arches, so your arches and the inside of your foot here drops towards the floor, maybe you have flat feet, those kind of problems, this is an important concept for you. If you just watch, and I'm going to raise my shorts here a little bit so you can see my knees. If I stand here and just watch what happens to my knees if I let my arches fall towards the floor, okay? The knees kind of go inward into what we call a valgus position. That is really hard on the inside of the knee, okay? So a lot of people that develop arthritis in their knees, that can be one cause. It actually starts down in the foot. Some imbalance and incoordination and lack of proper muscular activation on the bottom of the foot in the tripod. The other thing, obviously, going up the chain, if that knee is rotated in like that or falling in, that's going to affect the position of the hip joint. So we get an internal rotation of the hip joint, which can cause issues through the hip, lower back, and then all the way up the chain, not going into too much detail. So what we're going to do some drills to start working on or activating the tripod of the foot, the bottom of the foot. So it's definitely best to do these barefoot so you can kind of feel what's going on with your feet and really get those intrinsic muscles in the bottom of the foot starting to work properly. So all we're going to start with is a 2-foot stance, like a squat stance. I want you to get your feet fairly straight forward. If you have a little bit of a turnout, that's okay, but pretty much straight forward, and the feet should be right underneath the hips. What you're going to start with is just feeling the floor, feeling those 3 points of contact, and that you have equal pressure on all 3 of those points. Another point in all this, there's in the last few years, power lifters, Olympic weightlifters, those types of people who train with those movements are training a lot barefoot, and this is why, because you drive so much power up through your legs and the rest of your body when you can actually use your feet properly. So that's just an FYI, if you ever see that or wonder why that's happening out there. So just lift your toes off of the floor, feel the ball of the foot, the 2 points, make sure on the base of the big toe, the base of the little toe, and the heel you have an equal distribution of weight. You should almost feel like the bottom of your foot kind of grabs the floor a little bit. You should not have that inside arch down here drop towards the floor. So if you have flat feet, or if you feel like that arch is dropping, grab the floor a little bit with the feet to kind of activate the bottom of the foot. So you should be able to feel that. And if you do have this knee kind of going inward valgus load position, when you do that, you should feel like your knees kind of turn out a little bit, which is a good position for the knees and the hips. The next thing we're going to do is just start incorporating little squats and little lunges. So we're not going to go all the way down because that brings into a whole lot of dynamics with your mobility and things we're going to talk about at a later date. So we're just going to do what we call quarter squats and quarter lunges and finish up with another exercise. So get in position, lift your toes just a little bit off the floor to start, grab the floor just lightly to activate the bottom of the foot, push your hips backwards and then sit and then up. Push your hips backwards and up, and just through that motion, feel the bottom of the foot should not change. We shouldn't go on our toes, and we shouldn't rock back on our heels when we do this motion. So from the side, it's another important concept is to sit back or hinge through my hips as I squat. Too many people, it's actually a pretty bad advice to squat with your knees, not with your back. We actually should squat with our hips, not with our knees. So what I mean by that is not drive your knees out first. It should come through the hips like this, okay? As you sit back and really just kind of go down about a quarter, maybe to halfway, and just working on keeping that foot activated. All right, the next one is a little bit more challenging. So if you feel comfortable with that one, you're gonna move into a single leg stance. Walking, running, doing other complex movements, single leg stance is so important with balance, with coordination, to prevent injuries. This is the kind of stuff that you want to be working on. So all we're going to do, kick this foot out in front of us, okay? I'm going to have you guys, once again, try to balance on the tripod of the foot. So feel that foot grabbing the floor. Don't curl your toes in, though. That would be something we don't want to do. You're going to try to get your balance, and you're going to try to do just a little bit of a single leg squat, okay? It doesn't need to be very far, but what I want you to try to realize is what your knee's doing particularly, and if that arch is dropping. If your arch is dropping towards the floor and your knee is going in like this, such as this, that is not a good thing to do. That puts a lot of, like I said, shear forces and pressure on the inside aspects of the knee and some of the ligaments and tissues around there. So if that's a problem for you, you probably want to start with just the 2-foot stance stuff first and then move on to some of this as you progress and get stronger in the future. So that's kind of the test for this one. If you can do that without a problem, we're going to do a backwards single leg stepping lunge. So basically, tripod of the foot on this one, I'm going to step back and try to lunge, touch that knee, and back. So just a little bit, and you don't have to go all the way down. Like I said, you can do a quarter lunge, which basically would just be about to here and up, and then work your way lower and lower. Again, sitting back with the hip, not doing all that motion from the knee, and definitely not letting that knee come in like this. That is something you really want to pay attention to. Correct that by keeping the knee out, keeping the foot activated, and doing the quarter lunge. Okay? The last one is a little more challenging still. What we're going to do again is get a single leg stance. Okay, so I'm going to stand on my left leg, activate the tripod of the foot. I'm going to flex my hip on the other side up to 90 degrees. I'm going to abduct, which means go out this way or externally rotate. Try to keep my balance, come back, and then down. Up, out, and I can assist a little bit if I'm having trouble, and then back and down. So what we don't want to see on this one, again, anything with the knee or the ankle like this, I don't want to see your hips sway out like this to compensate. Keep that hip aligned with your knee and your ankle as you can go out here as far as it'll let you. If you have hip mobility issues, that might be tough for you. Don't worry about that right now. Just working on the bottom of the foot, keeping that whole leg stable as we go through that motion. So, 3 exercises: quarter squats, quarter lunges to full lunges, and then this one right here, we just call that flex and abduct. Go nice, slow, and controlled. If you do 10 repetitions of each one of those, you'll get a pretty good warm-up for the bottom of the foot. And then the next video we're going to talk about is moving right up to the ankle, which also plays a big, important role in how the foot functions. So hopefully this was informational, helped you out. Again, if you have questions, don't hesitate to let us know. My email is scott@synergylincoln.com. Thanks a lot, and good luck with this.